Hey guys, welcome back to my channel. I'm officially 5 months postpartum and I'm ready to get back on YouTube, get back into filming, dropping videos. But first, I feel like it's only right to explain where I've been, what I've been through, and how things are going now. Last I posted, I was pregnant. Very early on, I was diagnosed with gestational diabetes. Probably around like 20 weeks, I was diagnosed with gestational diabetes. We tried to manage my diabetes with diet and exercise, and that wasn't working. My fasting numbers would not come down, so I was prescribed insulin. At first, I was only taking a nighttime insulin, and I will try to include like the exact amounts, dates, pictures, all of that in this video. Was very early on diagnosed with gestational diabetes. I was put on insulin once we realized I couldn't manage it with diet and exercise. My numbers were not changing. I was on nighttime insulin, numbers still not changing, fasting numbers not changing. Eventually, they upped my insulin to higher dosage. Still, nothing is working. We added mealtime insulins additionally with the nighttime insulin. So now I'm taking 4 insulins a day, checking my blood sugar at least 5 times a day, watching what I'm eating. Nothing's happening. During this time, I'm also having gestational hypertension. I'm having high blood pressure. I'm on blood pressure medication. I think my baby was born in September, and since June, I was on high blood pressure medication. I'm seeing the high-risk doctor twice a week, seeing the regular doctor. Okay, so I'm having all that. Multiple times I had to go to the emergency room for high blood pressure. So crazy. Multiple times. And I'm just going to drop the clips because it's easier. It all feels so far now, but it really wasn't that long ago. I go to my high-risk appointment September 16th. My doctor says, you have to go to the emergency room after this. You have to have your baby today or tomorrow. Now my son, his kidneys were dilated where he had fluid in his kidneys, and my entire pregnancy, the doctors were basically like downplaying it, like saying, oh, this is normal. We see this with a lot of boys. Like, it's nothing to worry about. It'll probably fix itself on its own. Cool. I'm thinking it's no big deal. Come to find out, it was a very big deal. And the doctors downplayed this situation. However, my son had fluid in his kidney. His kidney was swollen to 8 centimeters. As a little baby, a newborn baby in my stomach, his kidney is measuring 8 centimeters big. Insane. So my doctor says, you have to go to the hospital after this. You're having the baby today or within the next couple of days. This is September 16th. I asked her, like, can I go home and pack some stuff? She says, yeah, that's fine. So I go and pack a hospital bag, call my family. My mom and dad are in another country. They're in London at this time. I'm freaking out, but there's nothing I can do. I asked the doctor, can I still have him vaginally? Yeah, that's no problem. Cool. We go to the hospital, tell them what's going on. They check me in, got me hooked up to all these machines. They're trying to figure out, like, what day am I going to have him? We stay overnight. The next day the doctor comes and he's like, yeah, you're not having him vaginally. There's a possibility that his kidney can rupture and he can die. So we have to have an emergency C-section. It's just a matter of, are we going to do it today or are we going to do it tomorrow? It's 10:51. Officially the last night. Just the 2 of us. Tomorrow, baby boy will be here. I'm about to eat a Lunchable and hopefully get some rest. The nurse is gonna wake me up at 5 in the morning, start me on some IV fluids. I can't eat or drink anything after 5 a.m. And then they're gonna check my sugar every 4 hours and start prepping me for the C-section. And then after that, he's gonna be here. I'm not sure how it's gonna go, if they're gonna, I don't think I'm gonna be able to hold him, obviously, because your hands are tied down when you have a C-section. But Mark will get to hold him and I'll get to see him. And then eventually, once I'm able to make my way over to the NICU, then I can see him, and seeing how he's doing, then hopefully it won't take too long for me to be able to hold him and kiss him and stuff. So that's where we're at. Now, for some reason, I always knew a C-section was a possibility, but I never envisioned it being my possibility. I didn't prepare for a C-section. I didn't do research on a C-section. I have the medicine ball. I'm stretching. I'm doing all the things, you know. I, in my head, was going to have a vaginal delivery. It didn't dawn on me that I was going to have a C-section. And let me back up. All this time, because I very much was like, when I was going to the hospital for these emergency visits for my high blood pressure, they were doing the test for preeclampsia. They said, no, you don't have it. No, you don't have it. No, you don't have it. Even my high risk doctor, the day she sent me to the hospital, she said, you don't have preeclampsia. When I get to the emergency room, the doctor says, yes, you have preeclampsia. So it was just so much confusion going on with this experience. And these doctors are supposed to be working hand in hand together. Anyways, he tells me I can't have the vaginal delivery. I have to have the emergency C-section. We don't know which day, if it's going to be tonight or tomorrow. Then he finally tells me, okay, we're scheduling it for tomorrow, the 18th. My mom's out of town. I have the recording of the doctor telling me, and I'm literally just like, okay, okay, okay. That's all I could say. I was in complete shock. My husband's looking at me. We don't know what we're doing. I expected my mom to be there, but God had other plans. My whole support system, except my best friend and my pastor, were out of town. So she's there at the hospital with me. Now it's time for C-section. I do my lashes, you know, try to get cute. It's 12:06. My C-section is supposed to be at 1 o'clock. And I'm in here trying to hurry up and put some lashes on. They give me the shot. No, so I'm sitting on the table. They give me the spinal or whatever. Instantly, I start overheating and I start puking on the table. Once it settles in a little bit, I lay down. They pull the baby out. He's fine. And then like 2 minutes later, his whole body turns purple. Now he's not breathing. He's swollen. Let me see him, kiss him.
And then we're going to take him, okay? And Daddy can come with us.
And they take him to the NICU. I'm like, okay, cool. You know, they get everything under control. At this point, I don't know how bad this situation really is. They take me back to the room. I'm still throwing up, everything. He's in the NICU. And then they tell me, we have to transfer him to another hospital. And you have to stay here. So, you're okay, baby. Mama's right here. So they allow me to go down and see him. And my husband's there. And I'm, you know, looking at him, talking to him. I didn't really get to hold him. And they wheel him away. Well, then I start throwing up. And so they wheel me away. So I didn't even get to like see him leave the hospital. And now they're checking my blood pressure and I'm still having incredibly high numbers. They up my medication. They have me on like some crazy dose of high blood pressure medication, triple of what I was taking when I was pregnant. Nothing is working. Nothing is bringing my numbers down. Days are going by at this point where I'm in one hospital and my son is in another hospital. It's day 2 post C-section. Here. This has been a crazy pregnancy. This has been an insane couple of days. Who would have knew that in September I was having a baby? That my baby would come over a month early, that my baby would be here before his baby shower, that my baby would decide to come when almost all our family and friends are out of town. And if it was up to him, I'm sure he would still be in his mama's belly, snuggled up with me. And even that feels so crazy, like him not being in my stomach no more, like that's so crazy. And that for the last 8 months, I could feel him kicking and he would respond to the sound of my voice, and he's not there no more. He's out, and I just can't wait to have that same experience when I get to see him in person. He was doing that on the phone though, like when my husband would have me on the phone in the NICU and I would say, "Hey son, hi son," and he would start moving and stuff, responding to the sound of my voice. So, okay, it's time for me to cut this off because I'm finna go into a whole crying spell. And I'm not trying to do that. My husband is driving back and forth 30 minutes between the two hospitals. I'm there mostly by myself, except my best friend coming and going. And I'm watching my son on a iPad, my newborn baby without his mom. There's so much mom guilt from not knowing that he was in pain in my womb. And it's just the grace of God that he's such a happy and sweet baby. Literally the happiest baby ever. Well, not ever, but like he's so sweet. There was so much mom guilt, and my baby's away from me, and he's probably looking for his mom. He's probably looking around, wondering where his mom is, and I'm nowhere to be found, and he doesn't hear me, he doesn't see me. They're feeding him, other people are connecting with him. Like, it was just such a traumatic and low experience. I was going through a depression. I was spiraling. I found myself getting sick. What else? So he's in the NICU at one hospital. I'm in the other hospital. They're holding me hostage in this hospital. First off, now six days are going by. My birthday's coming up. He was born on the 18th. My birthday's on the 22nd. My birthday's coming up, and I'm asking them, like, no, I need to leave. I'm crying. I'm just so sad. I need to leave. And finally, the doctor tells me, you know what? Okay, we know you want to get to your baby. We're going to let you go. Although the nurse was saying, I don't think you should leave. Like, I don't want to see you back here. I don't want something worse to happen. Like, whatever. But I wasn't staying in the hospital. So finally, they released me from the hospital. It is 5:52. I just got released from the hospital. Now we get to go see Peace. This is all I wanted for my birthday, was to get out that hospital and go see my son. I ain't seen the sun in 6 days. I ain't been outside in 6 days. That will really put you in a bad depression. I'm telling you, I didn't think I had another day in me. I was getting to the point of misery where I felt like I was starting to get sick and everything. Like, I couldn't take it. So I'm so thankful that they let me out. I go and visit my baby for the first time on my birthday. Hi, Peace.
You're the first one to hold him.
Hi, son. You have a serious face.
Like his daddy.
It's the best birthday gift ever. And he doesn't even know that it's been a week since he's seen his mom. I'm going up there. I got to feed him for the first time. He had no issue latching. Thankfully, I was able to like pump breast milk. And so they were supplementing my breast milk with formula. I got to start bonding with him, but he still couldn't leave the NICU. We were going through some issues where he had to have a catheter in. They were trying to get the swelling down from his kidneys. And we knew that he was going to have a surgery. I want to say like a week and a half in, he had his first surgery, where the issue was there was a blockage in his urethra where the urine couldn't come out, so it was going back to his kidneys. What the doctor said was basically like his left kidney took a hit in order for him to be able to live. And so they had to go through and clear a path in his urethra so that the pee could come out. So he had to recover from that. He had to start breathing on his own, meet all the milestones. It was the longest 2 weeks of my life. Me and my husband would just be at the hospital crying, like when we had to leave, or not knowing if he was in pain and there's nothing that we could do, or he was strapped up to all these monitors and had breathing tubes and all these things, and we couldn't do anything. We couldn't hold him some days. We just had to look at him through the little box. I think he had jaundice at one point, and they were telling us we were gonna have to have him on antibiotics. This was a lifelong thing that we were gonna have to track and follow, constantly doing ultrasounds and things like that. We're still seeing the doctors. He's on antibiotics, and he was on that antibiotics until he was about like 3 months, maybe 4 months. They finally took him off the antibiotics. He's healthy. His kidneys are recovering. One recovered, the other one we're watching. He's whole. I'm speaking healing and wholeness. In the name of Jesus, he's recovered. He's happy. He's healthy. He's not on antibiotics anymore. Everything is fine. He did end up having a second surgery. I forgot that. He did end up having a second surgery in November when he got his circumcision. They went through and did a second surgery. So we had to stay in the hospital for that for, I want to say like 2 days or so. Me and him stayed overnight. But now we're on the up and up. He just had purees for the first time 2 days ago. He's happy, he's jumping, laughing. You can't even tell that he's a premature baby or that he went through all of that he went through. You can't tell that he was in the NICU. You can't tell that he had any issues or complications. He's just happy and healthy. And that's really the grace of God and the love of God, that despite him being in the wound and uncomfortable and in so much pain, and it makes sense why he was frowning in all of his ultrasounds, but despite that, him still being so happy and so peaceful, he really fits the description of his name. But that's where we're at. Oh my gosh, I completely forgot all the complications I had with my C-section. So I had the emergency C-section. I'm up walking pretty fine, like a lot better than most people. I was able to stand up straight. I was able to walk around, cool. But eventually my incision wouldn't close all the way. And what my doctor was telling me is that because of the gestational diabetes, people with diabetes have a hard time healing. And my skin basically didn't want to seal. And so it was bleeding, it was leaking. I was scared that I was going to get an infection. It was hurting a lot of the times. So I'm going back and forth between my doctor, and she's prescribing me different things, making sure I don't get infected. But eventually it like wouldn't close and was opened up. So she took some silver nitrate and burned the incision closed. And when I tell you, this was probably the worst pain of that whole entire C-section experience. It felt like she took a knife and fire and was cutting me open with no pain pills and no drugs. Let's just put that out there. But eventually my C-section scar healed fine, and now it's fine. It's still very numb. Like when I touch the area where the incision was, or even my stomach, I can feel all the scar tissue, and it's like weird to the touch. But overall, we healed perfectly fine. Something I forgot to add was that I was supposed to be due October 23rd. That was my original due date, and so my baby shower was scheduled for September 27th. The baby ended up coming on September 18th, so while Peace was in the NICU, we ended up having the baby shower, and that's when I announced that, hey guys, actually, surprise, Peace is here. The baby shower came out so nice. Today is the baby shower. I'm currently in the room pumping, but it looks so cute out there. First I want to say hi. Thank you all for coming here. It was just surrounded by so much love and joy, and although our baby was still in the NICU, it was just so amazing to have our support system, and we gave a speech and just let everybody know what we were going through. And I can honestly say though, this whole entire experience brought me and my husband so much closer together. I could just see God's hand on it and the way that he was moving in our marriage and our own personal lives, and just setting things up for our future through this entire experience. Because while I wasn't able to be there for our son, my husband was there the whole step of the way. Like he was there with him, spending the night at the hospital next to him. And then when I finally got out and I seen those the setup in the NICU, it was very uncomfortable. And so I just really, like honor my husband for stepping up and being a wonderful dad and husband. Okay, so that was the whole pregnancy, delivery. Now we're talking about postpartum. I'm 5 months postpartum, and probably around like month 2 or 3, I started to realize that I was depressed. Obviously, I'm diagnosed with depression prior to getting pregnant. It's something I've been struggling with the last 10 years, if not longer. And I go through like phases of depression and anxiety. I just realized that what I've been doing the last 10 years hasn't been working for me. I'm in therapy, I'm praying, I have a relationship with God, I'm doing the things, and yet I'm still dealing with depression. And so when I talked to my doctor about it, we discussed getting on medication. And I talked to my therapist. She thought it was a good idea, so I went ahead and started antidepressants. I'm taking Zoloft. And so I started taking that, and immediately, once my body got used to it, I felt such a difference. In my mind, the thoughts, the negativity, life in general, it just didn't feel so depressing. It felt like a complete switch. Things weren't so big. My emotions weren't so high. My anxiety wasn't so high all the time. And I really noticed at Thanksgiving. That's when I first brought peace around like a lot of family. I realized that my anxiety wasn't as high as it would have been had I not been on medication. Eventually, I felt like I needed to up the dose. So now I'm on 75 milligrams of Zoloft. And I'm happy. I realized that it was just a chemical imbalance in my brain, and my body was just lacking something. And so now I'm on the medication to supplement and give my body what it needs to live a more balanced life. Since starting that, I feel a lot better. I am also exclusive breastfeeding unless somebody is watching him. Then I will give him a bottle. I'll pump and give him a bottle, but for the most part, it's exclusive breastfeeding. In the beginning, I was pumping and breastfeeding, and I found that for me, exclusive breastfeeding was a lot easier. I was getting overwhelmed with all the bottles and all the parts and the labeling and the tracking and doing all of that while having this new baby and going through depression and all the things. So I just found out that exclusive breastfeeding works better for me, and it's going good so far, and my son prefers it. That's where we're at. My baby's 5 months. Oh, there's so much I'm missing still. I'll do that in another video. But that's the update. That's where we are. That's where my life is right now. We're happy. We're healthy. Everything's good. My husband is amazing. And peace is doing well. Thank you so much for watching. If you enjoyed this video, give it a thumbs up. Subscribe to my channel so you can get more updates and see how we're doing and where I am in my journey. Love you. Thank you for watching. Bye.